Hi, good day. I am student nurse Sister Baguio and I am going to perform an open gloving procedure. So, in preparation for this procedure, I prepared here the surgical gloves that are needed later on on our procedure, and also our hand-based solution, or we could also do a hand washing procedure if necessary. Then after which, in preparing the open gloving procedure, then first I am going to remove the jewelries and other accessories in my arms or wrist, and also I am going to make sure that there is no artificial nails, extenders, or cheap nail polish, also open abrasions, and if there is any, then I am going to report it immediately to my supervisor as required. So the rationale for this is that jewelry, artificial nails, extenders, cheap nail polish, and also abrasions could harbor an additional microorganisms. So I am going to remove my jewelry. Then if you are a married person, then you will have to remove your ring because it could harbor microorganisms. And also I am going to check my nails if there is any extenders or artificials, and nail polish so clear and no abrasions seen or found on my hand. Next is I am going to ensure that my sleeves are at least 2 or 3 inches above the elbows, because the rationale for this is that this step prevents sleeves from becoming moist and prevents the transfer of microorganisms from the sleeves. Next one, prior to perform the procedure, I am going to perform a thorough hand hygiene or hand washing, or also we could use a alcohol-based hand rub. So I have here the alcohol-based hand rub. And the rationale for this is that this step decreases the bacterial count on hands and prevents the contamination of sterile equipment. Next one is that cleanses surface to open sterile field and raises its height to waist level if necessary. So we have to stay away from the waist level, so that the sterile items must be kept their sterility. Next, I am going to inspect the outer packaging of gloves for sterility, especially examine the packaging for the expiry date, the intactness, the tears, and also the package should be dry. So the sterile gloves have an outer packaging that must be removed prior to starting the procedure and of applying sterile gloves. This is to avoid the contamination of our sterility in our sterile field. So next one is I am going to open the sterile packaging by peeling open the top seam and pulling down to expose the second sterile wrapper. So I can see the second sterile wrapper here, and I am going to put this packaging on the side. Then I am going to place the inner package on working surface and open to see right and left gloves. So I could see here the right and the left gloves, the sign. Then I am going to open it, ensuring that the sterile part should be maintained or not touch on the unsterile field. So by opening or to open the packaging, I am going to start with my dominant hand first, which is I am a left-handed person. Then I am going to open the packaging and make sure to maintain the sterility of the gloves. So open the sterility packaging without contaminating inner package. So I am going to pick up the glove for my for dominant hand using only thumb and index finger by grasping the inside cuff or folded cuff edge of the glove by the help of my non-dominant hand. So by doing so, I am to get this one and place my dominant hand this one. Next is to make sure not to touch the outside of the glove and push the glove completely over dominant hand, leaving cuff and being sure that that it doesn't up wrist. Make sure that the thumb and the fingers are in proper spaces. So this step allows ease of application. Next step is I am going to insert the glove hand into the cup of the remaining glove by pulling remaining glove on non-dominant hand and inserting two fingers. So I am going to place my non-dominant hand inside. Then after we put our hands, or we already put our hand inside, then we could adjust the gloves if necessary to ensure the proper fit of our gloves to our hands, and vice versa. So once the gloves are on, interlock gloved hands and keep it at least 6 inches away from the clothing, while keeping hands above waist level and below the shoulders. This step prevents the accidental touching of non-sterile objects or the front of the gown. So after this one, I am going to remove the gloves by grasping the outside edge of one cuff or palm with gloved hands. So remember that avoid the touching the wrist. So this one. Then pull the gloves off, turn the gloves inside out, then place and hold the removed glove in your glove hand. So this is your glove hand. Then take the ungloved hand and slide an ungloved finger under the cuff of the remaining gloves. Peel the gloves off inside out over the previously removed glove, then bagging both gloves. Doing this is to prevent the contamination of hand when removing gloves. Next step is to discard the gloves in the appropriate waste receptacle, together with the wrappers and the packaging, then put in on the waste receptacle. This prevents the rationale for this is to prevent the cross-contamination and deters the spread of microorganisms. Then lastly, we are going to perform a hand hygiene after glove removal. The rationale for this is to remove the powder from the gloves, which can irritate the skin, and it also prevents the contamination from potential pinholes in the gloves. Remember that hand washing is also the most effective step in prevention of spread of infectious disease. And that would be all. Thank you.